VietBuzz.
Thank you so much for coming back to the VietBuzz show.
Speaking of living healthier and having someone to hold you accountable, let's head over to our health talk and chat with Dr. Tsay.
Well, thanks for tuning in. For our Health Talk segment today, I'd like to invite back with us Dr. Tsay. We had a great conversation last time with our Beauty Talk segment, but this time around, because it is January 10, 2017, the gym is always busier. I think according to this NBC article, my guest and I were talking, two of the top resolutions are getting healthier and getting more organized. So in terms of getting healthier, I think everyone has a different definitions of what that means. With your practice, by helping people getting pretty, but also living a healthier lifestyle, what does that mean in your opinion?
Well, with the New Year's coming around, a lot of people are asking me in the beauty industry, well, they packed on the weight during Thanksgiving, they had a huge Christmas dinner, and they also partied a lot too much during New Year's Eve. So they probably put on 5% extra weight or 5 pounds, 10 pounds. So right now, a lot of big New Year's resolution is to get healthy, but many people just want to lose weight. And that is so hard for many, many people. Obesity is a huge epidemic across the country. And not just for vanity and looking skinny and nice, but it leads to so many health problems such as premature diabetes, bad knees, bad bones, bad heart, cholesterol, you name it, and just
because you used to be an ER doctor
Correct,
as well,
correct.
so you're very familiar with these different chronic illnesses and things that kind of happen long term if you don't really take care of yourself now.
Right. I mean, here's an example. I just went scuba diving recently, and I packed on probably a 20-pound backpack with the scuba gear. I was walking maybe a quarter of a mile to go into the ocean, and just that walk, I was extremely out of breath, tired, fatigued, and just panting. And I imagine that's 20 pounds. Imagine people who are 50, 100 pounds overweight. They're chronically bringing on all that weight, and no wonder they can't get out of the couch. No wonder they don't want to go and walk around. That's a lot of work, and they get really, really tired.
That's true. That's true. I never thought of it that way. Yeah, you know, if you are not the weight you want it to be and all that extra baggage that you have on you.
Right. So yeah, we have a really incredible weight loss program that I actually did myself over the past 20 years, from 20 years old till now. I'm 44. Don't tell everybody my age. But I packed on 30 odd pounds, and you just get tired. Whatever I tried, eating healthier, cutting back the carbs, going to the gym, just nothing seemed to work. I mean, I may lose 1 to 2 to 3 pounds at the most. So I really had to do just a big overhaul and just change the way I did things. So I did the...
So it's a lifestyle change. It's not necessarily just doing one thing.
No, absolutely, absolutely, yeah. I mean, I did the HCG Weight Loss plan, which is what we offer at our office, which is combining a hormone injection and a 500 calorie a day diet. And I lost 30 pounds in 35 days.
Wow,
So
you were
this is-
35 pounds heavier?
Well, yeah, I was mapwa, say in Vietnamese. But yeah, I mean, I just packed on the weight over the years and just never thought I could get it off. And with this program, not only did I get it off, but I kept it off. It's been a year and a half, and it's still off. I mean, I'm at the weight right now when I was 20 years old, which is it's unfathomable.
Right. Are you still doing the 500 calories a day, or how does that work? How do we maintain that lifestyle? Because everyone's New Year's resolution is talking about living healthier. It's not just drinking more water, it's just living healthier overall.
So yeah, the program does involve a very strict diet, 500 calories. But honestly, after you're finished with the program, you do a little maintenance. You do 1,300, maybe 1,500 calories for a month after the program. And the majority of people do maintain it, but it's not just about that. You completely look at food differently. I don't down a whole cheesecake anymore. I don't eat buffets anymore. I don't eat that much rice anymore. So I've completely changed the way I eat and dine now.
Now you mentioned hormone therapy. What is that about, and why is it necessary with your diet plan and living healthier?
So hormone therapy is just for someone who's maybe a little bit older, or maybe not even older. If your hormones are off, that could be a big reason why you're having a hard time losing it. If your thyroid's low, you may need a little boost with your thyroid. If you are menopausal, or if you have polycystic ovarian disease, if you have too much estrogen, that all could cause you to have a much harder time keeping the weight off.
Does a younger person then somehow need hormone therapy along, or could it could just it's based on the person?
It's based on the person. I mean, we have young people that are 20 years old, 21, that are morbidly obese, that are really, really overweight, and of course they have some sort of underlying problem, whether it be they eat too much or they do have some hormonal imbalance.
I mean, this is a time where a lot of people are reflecting on their lifestyle, and of course, what would you suggest are themselves as a first step to living healthier? Because it all comes down to having some sort of action plan, right? Just by saying living healthier is it's such a broad statement.
Right. First of all, you need to be motivated, and I think this is the time of year when a lot of people are motivated. They're making their New Year's resolutions. They're writing it down. But you're right. You have to have a plan. Don't just say I'm going to eat healthier, or I'm going to try to lose weight, but you have to come up with a plan, A, B, C, and have a target.
Right. Is that something that you help with clients to on your plan? They can achieve it? Right.
Well, we, generally it's half a pound to a pound a day. So depending on how much weight they're trying to lose, they see us every week, not just for the fat burning shots that we give them, but also we keep them accountable. We look at their diet and we go over what they went wrong. If they cheated, I want to know why they cheated. I'm going to make them do 50 push-ups. I'm just kidding. But I want to know what it is that caused you to cheat and why you cheated. Because if we can correct that problem, you're not going to cheat in the future or think that way about food. So we do keep people accountable for their actions and their diet and their meal plan.
That's interesting. And I can see how that could be a lot more effective, is having someone holding you accountable. Because New Year resolutions is one of those things where people just keep hitting the reset button, as we were talking about it from our last episode, is you just kind of recycle the same New Year resolution because you didn't do as well as you wanted to do. Because I probably wouldn't want to show up and say, I ate really bad, I partied too hard, right? So.
Right. But that is reality. I mean, that's what people have done over the past month, and now is the time to...
So this is a really busy time for you.
Right now, yeah, a lot of calls and a lot of people are interested in doing healthy things such as the weight loss and also maybe looking into the hormones to see if there's an underlying imbalance with the hormones, to see if they can improve that, and then that'll make their weight loss a lot easier.
And you said that hormones is something that we never really think about, huh? And that means that means that there's something underlying that can help prevent someone who, even though they could be already doing all the right things, but can be holding them back.
Yeah, and also as we get older, I'm in my mid 40s now, and you can't eat the same like you did when you're 20. You can't have 5 slices of pizza and go to sleep and wake up and not expect to put on weight. You just can't. Our metabolism slows down, and that's normal part of aging. So we can help reverse that by giving you the same hormone levels as you were 20 years old again. And as you remember, when you're 20 years old, you can eat whatever you want. Not that you should drink beer and eat pizza, but you should definitely eat healthy, but you won't pack on all that weight and not be able to get it off.
I see. With the hormone therapies, with the eating healthier, your meal plan, and then what about workout plan? You mentioned 50 push-ups earlier for punishment, but what are there any physical activities that you encourage as well with your meal plan?
Well, believe it or not, the weight loss program doesn't really encourage a whole lot of working out, and there's a reason for that. You're only eating 500 calories, so there's not a whole lot of calories to burn. We do suggest maybe doing a light walk or very mild yoga or something like that during the program. The maintenance phase, when you go up on your calories, then that's the time to really kind of go to the gym and hit it hard and train, and you can burn a lot of calories. And a lot of people even drop weight during the maintenance plan. So it's not just about maintenance. Some people even continue to lose weight during the maintenance plan. But we don't really offer any training, but I do work with some personal trainers that can help you if that's a need.
Gotcha. Now 500 calories don't seem a lot. So what does a 500 calories meal look like?
Believe it or not, when you actually put the food in front, 500 calories can seem like a lot. I know it doesn't sound like a lot, but here's an example. Breakfast, you're eating half of a grapefruit. Lunch, you're gonna have 4 ounces of chicken and a handful of lettuce. You may have half of an apple for a snack in the afternoon, and then dinner you can have a few pieces of shrimp, 4 ounces of shrimp, maybe a cucumber and a small tomato. that's 500 calories. That's a lot. I mean, you can eat shrimp, you can eat chicken and beef lean, but
Right.
still you have access to all those types
No
of food.
extra sauces though, right? Because the sauces can have quite a decent amount of
Right,
calories.
there's certain sauces you can use, but generally you want to avoid any of the heavy, greasy, oily sauces.
Gotcha.
Yeah.
How long are you doing that meal plan for?
So it really depends on how much weight you're trying to lose. We have a 23-day program that if you're just doing 12 to 15 pounds on the average, you can do it in 23 days, easy. And if you want to lose a little bit more, if you want to do 25 to 30 pounds, do the 40-day program, and that's a very achievable. 25 to 30 pounds in 40 days, that's not hard at all. I mean, I did it in 35 days, so I did it before the 40 days, I cut it short, and then I went on my maintenance plan.
Gotcha. All right, that sounds doable.
Right, no, and you're not hungry, you're really not. We give everything, throw everything at you to help you with the hunger. The HCG itself doesn't make you hungry, and we even sometimes throw in phentermine, which suppresses your appetite. It's a prescription medication, and it can only be picked up at a doctor's office. So, you know, you're really not hungry, even though you're only eating 500 calories.
Really? So there's a prescription to suppress the appetite during
Yeah.
this 500 meal plan?
Absolutely, because you definitely need it. If psychologically that seems like very little food, you know, but once you take the phentermine, you really don't feel like eating.
Well, I think it still sounds a lot easier to do than, you know, all these detoxes and all these juicing diets where you can't eat anything at all but liquids, right? At
But you do have to be motivated. I mean, if
Absolutely.
you really are not that motivated, it's not for you. I mean, you really have to be in the mindset to change your life.
I mean, how can you tell someone is in the right mindset? Or is there anything to do, someone who's thinking about living healthier or losing weight can get into the right mindset?
Generally, first of all, if you're gonna pay money to do something, which is how I did, I just shelled out the money, that will keep you accountable because you don't wanna spend this kind of money and then just waste it by cheating every day and not complying. So you do need to be motivated somewhat, and if you're financially committed, I think you're gonna be motivated regardless.
Actually, answering to somebody actually helps
Right.
too.
Yeah, I mean,
once
our
you start-
patients have our business cell number. They text me sometimes in the middle of the night, sometimes late at night, and say, Dr. Tsay, I cheated. I ate, you know, a chocolate bar, and you know, I'll respond and I'll tell them what to do. You can do, you know, some push-ups, or you can do what's called an apple diet, where if you cheat, you're gonna go on an apple diet and you eat 6 apples for the whole day, reset your metabolism, and you drop another 1.5 to 2 pounds.
Oh, so there are certain rectifications, but you don't want to take advantage of it. I'm
Right,
sure.
you can't do the apple diet every day. Right, exactly. Right.
You mentioned a financial commitment. What does that look like for that meal plan that you mentioned?
So, 23-day program will generally run you $600, and that includes everything. All the injections, the supplements, the weekly visits. We weigh you, we measure you from head to toe. 23 days. So is $600, and that's all inclusive, right? So that includes all your hormone injections, that includes the fat burning shots, that includes my analysis, and also the fat burning shots every single week, and all the supplements that you get. And then the 40-day program runs $725. So it's a really reasonable commitment financially, and like I said, 25 pounds is not hard.
Gotcha. It sounds very doable, very manageable. I was just curious in terms of, are there any specific things out there that's local? Because, you know, some of my guests are, you know, lucky guests who are maybe fit, but living healthy isn't, being skinny doesn't mean you're healthy.
No, absolutely,
yeah.
that's very true. That's very true, yeah.
And that's why I brought you.
I've seen very obese people have normal cholesterol, and I've seen very skinny people have cholesterol that's through the roof. So it's not even about your body habits. It's really about, well, genetically is important, and what you were given when you were born, but also how you eat and your lifestyle.
Perfect.
So what's your New Year's resolution?
Well, I did share personal and professional earlier, but professional goals, I have quite a few things to reach this year
Right.
with my 2 companies, the clothing line and of course the marketing and PR company. The personal is one of those things that I'm one of those that I'm recycling, you know, living healthier, eating better food and drinking more water, keeping myself hydrated, and also helping, you know, empower other women businesses, women entrepreneurs. girlfriends.
Yeah,
for
that's got to be
example.
very fulfilling when you get back.
Oh yeah. Yeah, definitely. So I'm really looking forward to 2017. Do you have any New Year resolutions?
Business-wise, yeah, I'm in the same boat. I just want to give back. I signed up for some teaching sessions, and I'm going to be teaching some beauty and fillers and giving back to the community, to the people that are learning how to do all the stuff that I'm doing. And personally, you know, I've never had a six-pack before in my entire life. I've never had a six-pack. So now that I lost the weight and now that I'm on hormone replacement, I've got like a three-pack. So my New Year's resolution, I know it sounds really vain, but I want to have a six-pack, like all the people on TV. So there you go.
It's funny. My guest and I, we were just talking about six-pack sculpting earlier.
Right.
Perfect. Well, I'm sure you'll do just fine.
Even if it's just for like 1 week,
So-
just to have it. For 1
But
week,
you'll
and
take a
then-
picture, right? It'll last a
Absolutely.
lifetime.
I'm going to blast all over Instagram and Facebook. You got it.
Awesome. Well, thank you so much for being here. That was fun. Thanks again, Dr. TJ Tsay at Ageless MD in Tustin for coming by and talking to us. We wish you a tremendous and successful and healthy and happy 2017. Thank you so much for tuning in. We'll see you next time.
VietBuzz sincerely thank the following sponsors: Miss Alice Restaurant and Lounge in Costa Mesa, California; Ageless MD in Tustin, California. At Walnut Auto Care, you'll find a friendly and honest team to service all your maintenance and repair needs. Call 909-595-6677 today. VietBuzz.